Today on Eyewitness Newsmakers, the new Martin Luther King Jr. Community Hospital, 2.5 years later. Our guests, Los Angeles County Supervisor Mark RidleyThomas and hospital CEO Dr. Elaine Bachelor. The new hospital opened with a new mission and purpose after the old Drew King Medical Center was forced to close in 2007. The old hospital, which opened with such high hopes, closed after medical errors and questionable patient deaths.
This is a hospital. Supposedly we're supposed to get help. What kind of help is this?
Now the new hospital is smaller, with an emphasis on preventive care, and patients are responding.
It's really good for the community. It builds up your community to see that you have people that still care about you.
ABC7 presents Eyewitness Newsmakers with Adrienne Alpert.
Good morning, I'm Adrienne Alpert, and we welcome back to this program Los Angeles County Supervisor Mark RidleyThomas and Dr. Elaine Bachelor, CEO of MLK Community Hospital. Thank you for being here.
Delighted.
When we last did this program, one of the questions I asked was, you've got a brand new hospital, but what are you going to do with the old one? Is it going to be torn down? What were your plans? And now, Supervisor, there are plans?
There are good plans, there are exciting plans, and we take this opportunity to share them. We feel very positive about the integration of health services with public health and with health services and mental health. And now we will create in what was the original hospital a brand new behavioral health center, focusing on those issues that cause people to live better and live longer. And so this will be in part inpatient, but it will also deal with substance abuse issues, mental health issues. We will have the first autism diagnosis center there, as well as a range of services that deal with diversion. That is a new emphasis for the County of Los Angeles. It will be fabulous.
Of all the things that you could have used for the old hospital, why, Supervisor, was it that you think that mental health was the primary focus that it should go to?
Well, because mental health has been so stigmatized for so long. And in communities such as that which we focus on in the Watts Willowbrook area, it has been an underserved environment. And to the extent that we can bring the stigma to full force in terms of the kind of work that can be done to help these individuals who suffer a range of mental health challenges, then we can elevate the quality of life of the individuals and the community that surrounds them, their families and the like. And so this is very, very important. It's one of the new thrusts of the County of Los Angeles, and we're very proud to be at the forefront of it.
Got to ask a couple of bookkeeping measures. What do you think it's going to cost, and where are you going to get the money?
Well, fortunately, the county has done very, very well. The Department of Health Services, 7 years ago, when I first came on this program, I was running a deficit. Now, good news is that we run a bit of a surplus, and to the extent that that is the case, we know that we will come out somewhere around $250 million with respect to this new renovation of the facility, 500,000 square feet of services that's going to be very, 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 very important to that community and beyond.
Dr. Bachelor, do you see this integrating into the services of the main hospital as well, or do you see this standing alone?
We see it as part of the connected system of care that we're building on the campus and beyond the campus for the community, as the supervisor mentioned. Hospitals across California are struggling with a lack of mental health services. We have a lot of patients in our emergency department with untreated behavioral health problems. So we see this as a huge benefit for our community and a huge asset on our campus.
One of the other questions I wanted to get to right away was not too many weeks ago announced that there was going to be a large gift from Clippers owner Steve Ballmer and from the Weingart Foundation for a total of $15 million, $7.5 million each, as I understand, to help get more doctors into the South Los Angeles community. How does this work with your hospital?
Again, we're trying to build the connected system of care and bring the resources to a community that is very medically underserved. We have a 1,200 physician deficit in South LA, and we see the results of that every day at our hospital and on our campus. We see people with chronic medical conditions that are not being adequately treated because we don't have the physicians. So this huge gift that Balmer and Weingart are making will go a long way to bring new doctors to South LA to take care of our patients.
You already have an outpatient group, is that correct, in Compton?
Yes, so one of the exciting things we did last year is we began an affiliated nonprofit medical group, and we began to provide care for patients who were leaving the hospital who didn't have a medical home to go to. And we began recruiting culturally aligned physicians and starting to provide that pre-hospital and post-hospital care that's so important to keep people out of the hospital. And the gift will allow us to accelerate those efforts and bring even more physicians into South LA.
Supervisor, I want to ask you about this. I mean, so here comes Steve Ballmer, here comes the Weingart Foundation. Your reaction, I mean, you must have heard about this gift coming in. What do you think? I mean, often people don't just lay that kind of money out there.
Well, it's a huge shot in the arm. That is to say that it expresses quite a lot of confidence in this hospital. It says a lot about how the private sector sees its role in supporting the rather extraordinary work that's happening on the campus. It means that the MLK Community Hospital has garnered the attention of those who care and have capacity. And so when we talk about a public-private partnership, this is the illustration that we offer. And it's one of many contributions that have found their way to this hospital. And we are here to say the more, the merrier.
When we're looking at this right now, seeing this hospital, it still looks just clean and new.
Right.
You know, how do you feel, because you're the one who had to really pull the trigger and say, shut down the old one in 2007 when it just couldn't get right?
Well, I was at the hospital earlier this week, and Dr. Bachelor will make it clear that the emergency department is oversubscribed. And you know how chaotic that can be, but I just have to say, and I'm not the most uncritical person that you'll ever see, when I went there, there was order, no chaos. People were being cared for, just as the patient in your clip demonstrated. It communicated quite a lot of care. And so I give high marks to Dr. Bachelor and the entire team for how they are caring for the patients. They got the memo and they are carrying it out in a way that we are very, very proud of.
We're going to take a break in a minute, but I want to talk when we get back about how you have teams who are assigned to every patient, right, how you do follow-up care, how the nightmare in the old hospital of patients in hallways could not happen at this time. Dr. Bachelor, this is a private hospital. Does that help you in running it?
I think that it allows us to focus on the mission of providing health care. And we have been very successful at recruiting a talented workforce. I was employee number 1. We're now up to employee number 1,400. So we are one of the largest employers in the community, and we're proud that most of our employees come from the local community.
And you, before this, though, were running the nation's largest public health agency?
I was the chief medical officer at LA Care Health Plan, which is the largest public health plan.
And that helped you translate it into this private hospital?
It did, because I got to know the needs of our patient population, and I also got to know the providers who care for them.
All right, we're going to talk about that. They're telling us we need to take a break. So stand by. We'll be back with more on Martin Luther King Jr. Community Hospital right after this.
You're watching Eyewitness Newsmakers.
We are back talking about MLK Junior Community Hospital. One of the headlines I noticed when I was doing some research for this program was, will the patients come back after the hospital had been closed for so many years? What are your population numbers now?
So we are seeing many more patients than we ever anticipated before we opened. We thought we would see between 35 and 40,000 patients a year in our emergency department, and we're now up over 90,000 patients a year. So we have run out of space, but we are still full of heart and caring for our patients.
Go ahead, Supervisor. Sorry.
It's just a big confidence booster. The private sector, in terms of the philanthropic community, is saying yes to MLK Community Hospital, and the patients are saying yes. And they're saying yes because they're treated well, and the outcomes are worthy of celebration. And so this is a good thing. You mentioned earlier that the employment of the hospital, we started with a projection of 900
employees needed.
As Dr. Bachelor has communicated, it's 1,400, and it's a result of the need to be responsive to those patients, and that we've had to expand. Now, the Behavioral Health Center, as a part of the campus, a complementary service to the hospital and vice versa, will in fact provide some relief, because we do expect to decongest the environment through the use of the technologies that are available to us. And Dr. Bachelor will tell you that we are highly rated in terms of our technological advancement.
That's right. Our goal was to be high tech, high touch, and high quality. And on the tech side, the past year, we were recognized as a most wired hospital for our use of best practices in information technology for quality and patient safety.
Well, that kind of information translates to if an IV bag is empty, it notifies and alerts. If a patient gets out of bed, the bed has a sensor and lets people know that somebody's gotten up who might not.
That's right.
Have done that.
All of our doctors and nurses carry care phones that are integrated with the equipment and the electronic health record system. It all works together to support quality and patient safety.
You know, let's just get to this very quickly, because it's a question I've asked you, Supervisor, a number of times. One of the things that in closing the hospital and having to reopen it, as you have, it's a level 2 trauma center. Any chance you're ever going to get to a level 1 trauma center again?
We've taken that issue very seriously, and we began very methodically to build a high-quality environment for the patients. Patient care first has been our mantra. And to the extent that we know that a trauma center is very, very intense in terms of the resource drain, we do not want to have a scenario where we are pushing insolvency. Therefore, we have trained the doctors, and Dr. Bachelor can speak to this in terms of upgrading the skills in terms of trauma care. We've done studies on the issue of how much trauma care a particular region can handle. And now with the work that's being done at the St. Francis Hospital, we're moving them from level 1, level 2 to level 1. And so there is trauma care in the environment, and that was the major thing that we needed to satisfy.
Dr. Bachelor, you could probably explain this better than I can, because I think it's important to point out that to become a level 1 trauma care center requires having a brain surgeon on call. I mean, it calls for far more emergency personnel, correct?
That's right, and we're a new hospital, and as the supervisor said, our main goal is to build a high-quality hospital that meets community needs. Right now, the community's need for trauma care is being met, and we're here over time to do whatever the community needs. But right now, we're a small community hospital, and we're focusing on the most common, most prevalent conditions in our community.
Well, let's talk about preventive care, and we could probably spend the rest of this program talking about it. We have some video of the farmers market Wednesdays 9 to 2 in front of the hospital.
Right in front of the hospital.
And the farmers market is part of the hospital's mission for preventive care, because this is what healthy
eating is so important, and the next phase is for us to go upstream from hospital care to prevention, wellness, and disease management, and to address social determinants of health, like access to healthy food, housing for homeless individuals, transportation, community safety. That's all a part of elevating the health of the community, and not just being there to rescue people at the end.
So when we talk about healthy eating,
What is that guy?
I don't know what he's got. He's got a lot of vegetables there. But this has been going quite well, correct?
Yes,
this
it's a wonderful farmers market. They have wonderful, healthy produce. The patients love it. Our staff love it. I go out every week and load up on fresh vegetables that I take home to my family.
There's matching funds for this, too, for those who shop there, correct? There's a match program.
The farmers market network is structured in such a way that it has several revenue streams. The case with the county's Department of Health Services with the outpatient center is the driver in collaboration with the hospital for this, and so we have a multi-layered stream to support this. But this comes from the support from the staff, that is the employees at the hospital, at the outpatient center, at the university, Drew University across the street, as well as the community resident. All are welcome, and they all are taking advantage.
All right, they say we have to take a break. We have one more segment. Stay with us. We'll be right back.
You're watching Eyewitness Newsmakers.
Well, you're talking about Martin Luther King Jr. Community Hospital, and to the two of you, it's exciting to be here talking about this because this community still remains wanting for doctors, wanting for more preventive care. There is another phase coming in. Can you talk about that?
Yes, we're very excited about the work we're doing to expand services on the campus, and part of that is development of a new medical office building that will be a place that we can locate new physician practices and other outpatient services, like developing a center of excellence for diabetes care. We've been very successful in recruiting very talented physicians from places like UCLA and other top academic centers, and we'll be providing them a state-of-the-art outpatient facility to practice in as part of that continuum of care that we're creating.
Makes it easier to recruit, doesn't it, when you've got a good place for people to come to work and to be able to provide their service?
Absolutely. They want to work with great colleagues, and they want to have the right resources available, and we'll be providing both of those.
And this is part of the next phase, Supervisor. And again, this is for a private hospital, but it can use public funding, correct?
Right. There would be no Martin Luther King Jr. Community Hospital were it not for the county's significant investment. It's a tripartite agreement with the state of California, the UC system, and the County of Los Angeles. And therefore, we have this innovative hospital in the middle of a campus that has so much potential and is realizing that potential in terms of its new sickle cell clinic at the outpatient center. In addition to that, the recuperative care center, the urgent care, the center which focuses on psychiatric and mental health of patients, distinct from the behavioral health center. There's so many exciting things going on there with the university and more. I can tell you this is a hub of health that's making itself known in a very powerful way.
And it's revitalizing the community around it. Hospitals and medical care are anchor institutions. They're large employers. They stimulate economic growth. And we're seeing that development now spilling over into the surrounding area of South LA.
Well, you've got the train stop.
Right, Rosa Parks Transit Center.
So that helps bring people in.
Metro was there with a $60 million plus investment, and it's going to be fabulous. So you have Rosa Parks, Martin Luther King, Charles R. Drew. I can tell you it's making a huge statement, honoring those heroes and moving into the future.
So you've got sickle cell, which is something that needs to be addressed by so many people that probably didn't have any place to go for treatment. Is that correct?
Well, a new drug has just been approved by the FDA at Harbor UCLA. Dr. Nihara was working for 25 years, Adrian, on this new drug. Is just approved, and I can tell you those patients are just shouting hallelujah about it. It's a major breakthrough. Just went on the market in November of last year, and I can tell you it's a long time coming, and the pain and suffering that so many people have endured, they're going to get relief, and a part of that is that the clinic at the MLK Medical Campus, and it's a fabulous story unto itself.
And what about diabetes? What about prenatal care? All that coming on?
All of that available on campus as well. As you know, diabetes is epidemic in our community, and so one of our goals is to help members of the community manage their diabetes effectively. We do way too many amputations at the hospital, and it's a reflection of the failure to go upstream and manage the diseases appropriately. So that's a real area of focus, and we will have all of those resources on campus to do that.
Supervisor, you worked for so long to bring this about, and I know that you have been in public office a long time, from the city to the state, here to the county. Would you, if I was to ask you what will be your legacy to Los Angeles, would you look at this one?
Well, it's hard to ignore it. When I visit the hospital, as I have done with an increasing amount of frequency, I'm learning new things every time I go. We're building a brand new child care center for the employees and the community. 1,200 parking space facility for the employees and the patients. The Hope Emergency Center. So many fabulous things are going on, and so I had no idea that my heart would be filled like it has been when I visit that hospital and see those patients and hear unsolicited testimonies as to what a difference it's making.
Thank you. They've just told us we are out of time, but to Dr. Bachelor and Supervisor RidleyThomas, thank you for coming in. Let's check back in again sooner.
Indeed.
Okay.
Thank you for having us.
Thank you.
Eyewitness Newsmakers will be right back.
You're watching Eyewitness Newsmakers.
Thank you for joining us this morning for Eyewitness Newsmakers. If you have comments about this program, we invite you to join the conversation on Twitter and Facebook at ABC7 Adrian. For all of us at Eyewitness News, I am Adrian Alpert. Thanks for watching.